Alberta citizens and Alberta workers did not get the support and protection that they deserved during the first 3 years of the COVID-19 pandemic. Nurses and healthcare workers should not have had to fight for proper PPE like N95 masks. Meatpacking workers should not have been forced to work in conditions where everyone knew they would be subject to infection, disability, and even death. Grocery store workers should not have had to wait months for so-called hero pay, and they should not have had it taken away from them ever, but certainly not while the pandemic was still raging. And long-term care workers should not have been left without adequate staffing support to deal with the unprecedented wave of disease and death among the patients in their care. Our leaders failed us then, and they are failing us today. They have sent the message, both implicit and explicit, that the threat is over. They have sent the message, both implicit and explicit, that COVID is just another seasonal illness like the flu. They have sent the message, both implicit and explicit, that masks don't work and that natural infection will build adequate immunity. But the science tells us that none of this is true. In the same way that our leaders failed us during the first 3 years of the pandemic, they are failing us as we face long COVID. Just last week, Canada's chief science advisor said that long COVID is shaping up to be a mass disabling event. A week before that, the U.S. Centers for Disease Control quietly released a memo to doctors saying, and I quote, "Emerging evidence suggests that the virus that causes COVID-19 can have lasting effects on nearly every organ and organ system in the body, even weeks, months, and potentially years after infection. Documented serious post-COVID-19 conditions include cardiovascular, pulmonary, neurological, renal, endocrine, hematological, and gastrointestinal complications, as well as death." But it doesn't stop there. Just a month and a half ago, one of the world's most respected science journals, Nature, released a survey of all the research that has been done on long COVID around the world and concluded that, and again I quote directly from the report, "Long COVID is an often debilitating. Sorry, my mouth is freezing. Long COVID is an often debilitating illness that occurs in at least 10% of COVID infections. More than 200 symptoms have been identified with impacts on multiple organ systems." What this tells us is that COVID is not over. COVID is not just another mild seasonal illness. It is not even exclusively a respiratory illness. The science is telling us that it is a vascular disease that weakens our blood cells, causing blood clots and inflammation and the failure of capillaries that carry blood and oxygen to our organs. The science is telling us that COVID causes immune system dysfunction. The science is telling us that you can get long COVID even if your initial infection is mild. And the science is also telling us that repeat infections increase the likelihood of getting long COVID. In other words, the more we ignore COVID, the worse long COVID is going to get. So how many Albertans are at risk? Well, Statistics Canada estimates that 14% of Canadians who get COVID, even mild cases, will get long COVID. We've stopped testing, but if we assume that 80% of Albertans have had COVID at least once, That means that 515,000 Albertans either had or have long COVID. This helps explain why so many Albertans are complaining about getting one cold after another this winter. It also helps explain why heart attacks and strokes are on the rise and why so many people are suffering from things like brain fog. And as our American and British cousins are starting to realize, it also might help explain why we have a labor shortage, as many people suffering from long COVID are not able to return to work. Long COVID is not a notion, it's real, and it's not something that's coming in the future. It's already here. It's affecting our health, it's affecting our ability to work, it's affecting our quality of life. It's even contributed to the most dramatic drop in Canadian life expectancy since the Second World War. So what do we do about it as a community and as a province? Here are our top 5 demands from the Alberta Federation of Labour and the Alberta Labour Movement. First, we need to resume testing, both patients and indoor environments. You cannot understand something that you don't measure. Second, we need to introduce and enforce higher standards for indoor air quality. We don't let our citizens, workers, and children drink dangerous water. We shouldn't let them breathe dangerous air either. Third, we need to arm our health professionals with better tools, like training on the latest research on long COVID and billing codes for long COVID, like they've just introduced in Ontario. And we need dedicated long COVID clinics in every community around the province. Fourth, we need 10 mandatory paid sick days for all Alberta workers. The best way to avoid COVID is not to get COVID in the first place. And the best way to not get COVID is to not be around people who have COVID. That means making it possible for people to stay home when they're sick. Finally, and perhaps most importantly, our leaders, both in government and in the public health community, have to start telling the truth about COVID and long COVID. They have to stop being afraid of being the bearer of bad news. They have to stop putting politics ahead of the public interest. And perhaps most importantly, they have to stop pandering to extremists. We can't let the failures of the past 3 years become a prelude for failures for the next 3 years or the next 30 years. Alberta workers deserve better. Alberta citizens deserve better, and it is time for all of us to demand better. Let's make action on long COVID the priority that it needs to be. Thank you very much.